Of course, we're all dealing with the COVID-19 pandemic right now, but there's something you have to keep in mind. Preventative care. Maybe you have a chronic health condition. You want to make sure you stay on top of that. And with that in mind, we're going to be checking in right now with Dr. Larry Severitt, the Director of Medical Education and Section Chief at Broadlawns Family Health Center. Good morning, Dr. Severitt. How are you this morning?
Good morning. Good to see you, Lou.
We are talking about some things that people really need to keep in mind. And I'm sure with the COVID-19 pandemic that is going on, there are some people that might be a little hesitant in going to the doctor and trying to stay on top of some conditions they might have. And that's what we're here to talk about this morning, isn't it?
That's correct. Yes.
All right.
And with your permission, I'll just share our COVID story a little bit.
Sure, please do.
All right. So I'm the Director of Medical Education. So we have a residency training program. And I don't know if you recall, a few years ago, I was on your show with a couple of my residents. And so we have a model office, and basically we run this just like a traditional family practice. And there are 35 physicians there, 28 of them are in training, and then the rest are faculty physicians. And so COVID kind of disrupted everything. And our initial response to COVID was to create an urgent care clinic. And the concept was that we wanted to keep our patients with chronic illness and elderly patients out of the office and off the campus if we could. Because of course, as everybody knows, they have a lot of comorbidities, and we wanted to do everything we could to keep them well. So what we attempted to do is to manage them with telephone visits and virtual visit. And for the most part, that went really well. Now the curve is flattened. And so our goal is to safely open for in-person care. And what we discovered is some of our sicker patients with chronic illness just weren't getting care, and so they're sick now. So we're trying to get them in.
Wow. And you said that this is what you want to do now, is make sure we maintain the health of people that are outside that zone that you just talked about now. And how is that going now? Hey, you said you started that back up again. How's that going?
Well, it's going quite well. And what we're taking several steps. And this is not unique to Broadlawns. I think all the clinics in the metro area are kind of doing the same thing. But we start out, all patients have to have a mask. And if they don't bring a mask, we provide a mask.
Okay.
And one of the really cool things that's happened during this crisis is a friend of mine, Pastor Mike Foss from St. Mark's Lutheran Church, has got a group of ladies that are manufacturing masks and hats for us. So we have many masks that we can provide our patients with. So when a patient comes to the clinic, they are screened at the door, they answer questions, they get a temperature check, and then we try and have a nurse directly take them to an examination room. The goal is we don't want a bunch of people sitting in our waiting room. So directly to the room. All of our providers wear a mask and a shield. And then obviously we clean the rooms carefully before and after each visit.
Wow, and so that makes people feel a lot more comfortable. And are they telling you when they're coming in, are they telling you about the fact that, hey, I avoided coming in because I was a little afraid to come in? Is it making them feel a lot better?
Yes, absolutely. And we've been able to reassure them with phone visits that we're taking these steps to protect them.
Now, you mentioned everybody's wearing masks, and that's something that we're hearing more and more in the news about right now is they want people to keep wearing the masks and social distancing. Of those two things, what do you think the priority is, if there is such a thing, the social distancing or wearing of the mask if you're going out in public?
Well, we don't have a cure for COVID-19. We don't have a vaccine. So there's three things that work. And wearing a mask is one of them. And when you wear a mask, you're actually protecting your friends and neighbors and people that you run into. The mask doesn't protect me, but if I have it, it protects you. So I don't pass any of the virus to you.
Got it.
So masks are essential. Social distancing is essential, and it needs to continue. And then the other thing is just avoiding big crowds. If you're in a big crowd without masks, you're just asking for trouble.
Now, I want to go back and talk about the masks because this is something that they're just touching on right now. We keep hearing cloth masks, and if you are wearing a cloth mask, should you be cleaning that mask since it's you that is wearing the mask? Do you need to clean that on a regular basis, or if it's yours, you're fine?
No, you should. You should wash it regularly. Ideally, every day or every other day, it's a good idea. I would do that, and that's sort of the advantage of cloth masks. You can wash them and reuse them.
Right. Now, you mentioned the different care centers that you have around town and Broadlawns. You guys have three different locations that you have. Now, you're located over on Hickman, is that correct?
That's correct, on the main campus.
On the main campus itself. So you have that location. You also have one over on East University, which has become very popular since it was built, hasn't it?
Yeah, that's been very successful, very busy clinic, and very accessible to our patients. We have a lot of East Siders that have gotten their care at Broadlawns for years and years, and so that works out very well for them.
And what about the one over on Southwest 9th? That's the one that is really gaining a lot of attention because of the convenience factor for people on the south side or even in the downtown area too, isn't it?
Yeah, that's Cityville. And, there are so many people that work downtown that it's very convenient for them to slip away from work for an hour and get a medical need taken care of, or even over their noon hours sometimes. And that has both primary care and an urgent care clinic, both.
Okay, Dr. Severidt, if people are thinking to themselves right now, something, I need to get back in, I need to get checked up, I need to get some preventative care, maybe I have something serious going on, I need to get in and see somebody. What is the easiest way for them to get a hold of the folks over at Broadlawns?
Well, they can just call our office or call the general hospital number and ask for the Family Health Center. And then we are setting up appointments, and we're starting to fill our schedule with regular appointment. So we're making it as easy as possible and certainly as safe as possible. Yeah,
I also noticed if you go to the website here and see an amazing website, by the way, Dr. Larry, that is really cool. You have a psychiatric urgent care too, which especially with people being locked down the way they are, that could really come in handy.
That's been a wonderful addition. That was the first acute walk-in clinic for psychiatric care in the state of Iowa. And it's been a very big success. And as you know, Lou, it's difficult to get in to see a psychiatrist, but this clinic is open and available, and it does its best job to see people in a very timely fashion.
Dr. Larry Severidt, great to see you again, buddy. You take care of yourself. You stay healthy, okay?
Yeah, you do, and wear your mask, Lou.
I'm going to wear my mask.
Take care.
I have it right over here. We'll be right back.